Viewers now, thank you so much for being here, folks. My name's Joe Payne. This is Political Pain. Again, keeping it casual today. Got my t-shirt on. But I want to talk about some very gravely, and by gravely I mean literally, serious stuff. So one of the first things I want to talk about today is coronavirus. Can't bury the lead here. Coronavirus is out of control. The numbers are escalating like crazy. And guess what? We're 2 weeks out from Thanksgiving. So now we are seeing the outcome. We're seeing in the numbers the totally and completely predictable outcome of people congregating, getting together for Thanksgiving, even though they were continually warned not to by epidemiologists. If you listen to epidemiologists from the beginning of this thing, they actually predicted this time of year particularly was going to be especially bad. That the first wave was bad, but that what we really had to be concerned about was the wintertime. And when people started crowding back indoors, and especially the holidays, when people, despite all the warnings, all the notifications, and all the measures and lockdown orders, what have you, still just say no thanks and congregate in together. Just last week, I had to talk about some of the cavalier attitude here on the central coast of California. I'm in Santa Maria, California. That's in northern Santa Barbara County, just below the border with San Luis Obispo County. And these counties were included in the Southern California region of the regional California lockdown orders, right? I had to talk about this guy, local assembly member, Republican assembly member, Jordan Cunningham, who released a statement on Newsom's most recent stay-at-home order saying he thought it was unfair, and he even called it punitive that Gavin Newsom would include the Central Coast. It wasn't fair. Well, now that we look and see what's going on, or now just 1 week later, 1 week after he, or to be fair, it's about 2 weeks. This was in December 3rd. After we've gone on lockdown now, because predictably the numbers went up. Last week, people were complaining that our hospitals were doing just fine. Well, not so the case anymore this week. Local hospital chief say COVID-19 pandemic is worse than portrayed. This is KSBY TV. Television news, they're not the most thorough. They're not the best, but they are trying to get the message out. SLO County, the San Luis Obispo County Hospital chiefs are sounding the alarm. The pandemic has been gravely underestimated on the Central Coast. San Luis Obispo County, there's quite a cavalier attitude because even from early on, they didn't have quite the numbers that Santa Barbara County and others had. But now they're in the contending. Now that their numbers are escalating, they had 300 reported new cases in one day. This isn't the most populated county in California, folks. So that's quite a number, and there have been several deaths since then. Let's see, this French hospital director, ICU director, Mark Soul, he, along with other hospital chiefs, wants the community to know that dramatic increase COVID-19 hospitalizations and ICU admissions are straining our hospitals. Quote, things have been really escalating at the hospitals, and we're starting to have to scramble for beds to put patients into. He explained that all 11 ICU beds at the hospital are full. Quote, you see all these people complaining about us being lumped in with Southern California with their 85% occupancy. Well, we're in just as bad a shape, if not worse shape, than much of Southern California. So, totally predictable. Everybody said this was going to happen. And, continually, whenever you see KSBY or one of these still corporate owned, but again, locally placed media companies drop this on local social media, you have a litany of, denialist, often obviously Trump supporting commenters who are just excuse after excuse after excuse. Literally, somebody said last week, I saw a comment that said, somebody said, last week the hospitals weren't at capacity. Now they're at capacity. Something's fishy here. That's literally the level of logic, right? That's operational here, is people are just see that the numbers are going, well, that doesn't make sense. They weren't before. It's because of this. It's because people aren't taking it seriously. They aren't, it's, not just the hospital chiefs are sounding the alarm on this. And this is what really upsets me about all this is it's the hospital staff, the people who are tasked with taking care of people who've contracted or are affected with COVID-19, having a rough time with it. Central Coast healthcare workers expressed concerns with hospital conditions as COVID cases surge. The union leader, let's see, the numbers have just exploded, as everyone knows, in the past 10 days. In the past 2 weeks, there's no getting around that. Let's see, if we do what we did on Thanksgiving, we are just going to have numbers that are just going to max out the system, and our workforce is extraordinarily concerned about that. Here we see in the Washington Post, California hospitals crushed as virus patients flood ICUs. So in LA County, they're already talking about rationing care. They're going to have to start rationing care. This is the worst case scenario. This is exactly what we were talking about, flattening the curve in March, taking this serious. And I get that people are upset that they have to go through all this again. I get that nobody wants to live under a lockdown, but at the same time, this virus doesn't care. It's so trite to say to bring up facts don't care about your feelings, like Ben Shapiro would say. But the virus does not care that you're tired of the virus. The virus ain't tired of us. It's spreading. It continues to spread like wildfire. And we could have been in a better spot now if people took it seriously from the beginning. We could have been in this better spot. We could be in a better spot right now if people took it serious 2 weeks ago for Thanksgiving. It's very upsetting. When this whole thing started, a buddy of mine interviewed me for his YouTube channel. And he knows that I'm always following the news and everything. He asked what am I doing? I told him I'm staying at home as much as possible, not going around other people. If I'm going out, I'm walking around the park, not getting close to people, limiting my time indoors with other human beings. When I do, I wear a mask, right? And he asked, what can everyday people do? What can the variety of people do? And I think a really important thing that anybody can do is build up a basic scientific literacy. Like just that. If you just start with that to try to understand basically, the scientific method, the operations of science, how peer review works. You know what I mean? I mean, this sounds totally pedestrian and silly. But when you take a look at some of the comments I've just seen in my local media about the fact that we're at ICU capacity, you start to get it, or the vaccine, the Moderna vaccine, the Pfizer vaccine. Our hospital workers in Santa Barbara County and SLO County just started getting shots like today and yesterday, vaccinations, that is. So this is, the way when you see people reacting to this, you can clearly tell that there's a huge lack of scientific literacy, of just basic, also media literacy. Let's get real, right? I mean, it's a systemic problem. I think a lot of this has to do with education, with the attacks and the defunding of education. But again, there's a lot of factors that go into this. But you or anyone I think it's important you get a basic scientific literacy. I see in the comments, hey, it's Jason from This Is Revolution. Hey, Jason, how you doing, man? Thank you for joining us. I enjoy your show a lot. Guys, go check out This Is Revolution. Really, really great interviews, deep dive stuff, pop culture critique as well. Of course, the deep insider leftist baseball, but also, talking about movies and culture. I love that stuff. I absolutely love that stuff. I loved your interview with Toure Reed, Jason. Thanks for that. Valor, peer review is such a big part of accepting scientific findings. Exactly. And it's really interesting that some of the in the vaccination question, in the anti-vax movement, that the big conspiracy theory about vaccinations causing autism came from a study that once underwent peer review, was absolutely debunked, and pitifully so. So that is very interesting. This is the weird thing. So we're now in the most dangerous point of the pandemic. If you were like me during March and April, when you went to Smart and Final or whatever supermarket, you had I mean, my blood pressure spiked. I was having cortisol dumps in my brain. Just the stress level was huge. But then, like any human, habit, you get used to it and you attune yourself to it. And just, well, I got my mask. I'm washing my hands. Here we go. Now we have these. Now you should be that concerned now going into with the amount of spread of this virus. You should be that concerned now going anywhere, doing anything where you're in an enclosed space. Le fin absolute demande. I'm going to start referring to you to as that. That's awesome. The lack of research that went into that stuff. Yeah. So, that's concerning. And the fact that these things are so streamlined. But what's really interesting about the Moderna and the Pfizer vaccine, which the Moderna one just got approval today by the FDA. They are mRNA or mRNA vaccines. This is not the same as a vaccination where you're being given the dead virus and your body's building immunity to it. This is a vaccine that uses RNA and literally works on the cellular level. Your cells take it in and actually learn how each cell will learn how to identify the actual shape of the virus. Why we call it a coronavirus, because of the spiky shape of it. It's part of what makes it so what's the word I'm looking for? Contagious, is that it's got these little spikes all over. It's very easy for it to latch on into your biology, right? Yes, California is the epicenter. We were just looking at this. California hospitals crushes virus, patients flood ICUs. We're in a rough spot. And here on the Central Coast, people want to act like it's not that big of a problem. It absolutely is. They were complaining that we're part of the Southern California. Well, guess what? Once they reach capacity in LA and Ventura counties, people are coming north. They're coming to our hospitals. But now our numbers are escalating and going through the roof. So again, in LA County, they're talking about rationing care. This is super, super serious, super concerning. Very bad, folks. It's very bad. Now, why did it get so bad? Why are other countries doing much better with this? Nobody's perfect. Well, okay, I take that back. New Zealand has no coronavirus. They've reopened. They completely eradicated it. They have contact tracing, screening. You have a rapid coronavirus test before you get to fly there or boat there. You have one when you land or arrive. It helps that they're an island, that they're a smaller country, they're an island. But there are other countries we can compare to and look at. We ain't doing so hot. We're literally leading the world in deaths. We're doing the absolute worst with this. Levin's bringing up socialized medicine. Oh, gee, I don't know. Could be. The Weekend Valley people. I think I know what you're talking about there. Here on the Central Coast, I'm in northern Santa Barbara County, SLO County. We know that the Bakersfieldians they flood the area anytime, every weekend, anytime the weather's nice, every holiday weekend, all of that. I'm not going to blame everyone from Bakersfield. It's not fair. LaFin, a culture where public health is funded on the same scale as military. Yeah, in New Zealand, yeah, absolutely. But here's the thing. So, I tend to think leadership has a little something to do with how our government responds to this. We have a massive federal government that can declare emergency powers, emergency situations. Trump was more interested in invoking emergency powers to club leftists in Portland over the head. And shoot toxic gas at them with ice Gestapo, basically, pulling people in unmarked cars. He was cool with that. That's totally fine. But to actually coordinate a huge and massive and historic response to a huge and massive historic pandemic, can't be bothered. Some of this has to do with just right-wing ideology. It's not like every decision in the government comes down to Donald Trump. It comes down to the people he appoints. And Donald Trump's cabinet and his administration is filled with right-wing ghouls, people who have been champing at the bit, not just Bush people, but Tea Party people, all kinds of wackos and creeps and liars. And, a couple white supremacists are in there, right? but also know-nothings, people with no scientific literacy. People from the comments of the Facebook stories basically are in the Health and Human Services and the CDC. And we see proof of that. And, a lot of people, when I get in conversations with people who maybe support Trump or maybe want to appear that they are a little more, I don't know what's the word, both sides, the people, it's both sides are the problem. They really try to make excuses about how Trump and the Trump administration handled this whole thing. And it's really hard to get across, that there's all the things beforehand, like the removing the pandemic response team from the National Security Council. We had a team, 40 plus of epidemiologists in Beijing who kept an eye on Wuhan, that you could stack all these different factors that just led beforehand. But then once they knew it was a thing, of course, Trump denied it. Of course, he said it would just go away, all those things. But what was going on behind the scenes? And it's often not until much later that you find these out. And a recent House investigation just found that a high up public relations guy at Health and Human Services who claimed, who people in Health and Human Services believed was speaking for the White House, speaking for the president. What did they want to do? They wanted herd immunity. You might have heard this on right-wing media and others, or again, the Facebook commenters, your crazy right-wing uncle. Here we see, quote, we want them infected. Trump appointee demanded herd immunity strategy. Emails reveal. We want them infected, he said. Okay. Now, when we go down and we see some of the text of the email, there's no other way. We need to establish herd, and it only comes about allowing the non-high-risk groups expose themselves to the virus. Period. What was this, Sean Spicer? This is then science advisor. This is a science advisor to HHS. Paula Alexander wrote on July 14th, oh, he's working on a holiday. I mean, okay. Health and Human Services Assistant Secretary for blah, 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 blah. Infants, kids, teens, young people, young adults, middle-aged with no conditions, etc., have zero to little risk. So we use them to develop herd immunity. We want them infected, Alexander added. It might be that it will be best if we open up and flood the zone and let the kids and young folk get infected in order to get, quote, natural immunity, natural exposure. What does this remind you of? This reminds me of, there's always that one hippie family in town. I'm a hippie myself, but like kind of novo hippie where I can hold down a job and bathe regularly, but have the heart of a hippie. But those people who have like the chicken pox parties where one kid gets chicken pox and everybody comes in and let's all get our kids to hang out with the chicken pox kids and let's play let's play Bob the Apple together, all in the same bucket or whatever, obviously trying to infect the other kids because we just want them to get it. This is the same attitude with the entire United States of America. Okay. Now, why is this a problem? Why is this? I mean, if you're anybody who knows anything about, again, have basic scientific literacy, this is going to be horrifying. You're going to see this and go, oh my, well, like what? We all heard the tape, hopefully, of Trump talking to Bob Woodward that, I've been downplaying the virus. I've been downplaying it. This right here is more than just downplaying it. Now, why is herd immunity so bad? Herd immunity is only ever used specifically to refer to the immunity that's built up when we have a vaccine, when more than 60% of a population is vaccinated, so that the rest of the population that has not is therefore protected by that. Okay? That's what herd immunity means. So to build herd immunity with a novel virus without a vaccine, what does that look like? That looks like more than millions of Americans dead. I live near a gun store in Santa Maria. I like to talk to the conservative owner. We got in this exact argument months ago. He started saying, we need herd immunity. We need herd immunity. And I said, that's not possible, man. Like, we need a vaccine for herd immunity. And he's like, well, this is just crazy. And they use all the same lines. They repeat the same stuff. The cure can't be worse than the disease and burr, right? All that stuff. And, he said something like that. I said, so let me get this straight. Because guess what? Shooting for herd immunity without a vaccine is what's the word I'm looking for? It's eugenics. It's eugenics. You're basically saying let the weak die, let the old. I mean, this guy's saying infect the young, infect the middle age, infect everybody, and and we're just going to accept a certain amount of collateral damage among the citizenry, mass death, right? So this is a eugenics program. This is a United States-run eugenics program. Anybody remember in April and May when the numbers started coming out that this was most heavily affecting people of color? This guy wrote this email after that. And the Trump administration and Republicans all over the country were arguing for reopening everything after that information came out. Coincidence? And this is what I said to this right-winger, guy I'm friendly with, try to be friendly with. So I said, so basically we need to conduct a nationwide eugenics experiment so you can go back to Buffalo Wild Wings. And he kind of like chuckled and went, well, yeah, but and I don't know how much of that was just a cavalier joke, but here we see that this is what we're dealing with. This level of aggressive ignorance, and here we are, man.